the ECT therapy was because of a particular suicide attempt. Is that right? Or
It wasn't an attempt. I got very close. I got very, very close, like centimeters away. And it was after I had felt like I had tried everything. And it was, like I said, the conveyor belt of medication, 5 different institutions, CBT, DBT, EMDR. I had done somatic. I had done experiential. I'd talked to the empty chair. I'd held the pillow. I had beaten the things with bats while screaming. Like, I had done so many things. TMS did help a little bit with the OCD, but it had no effect on my depression. The stellate ganglion blocked was a very, do you know what that is? It's like a shot of lidocaine into a collection of nerves in your neck, and it's supposed to help with PTSD and kind of reset your nervous system. I got like relief for a week, and then I went back into the other side and got another week. And, Hoffman gave me probably the longest stint of relief was I had like a couple months after Hoffman where I was really happy.
wow.
And that was amazing. And something that I've learned with all things is integration is the number one thing. If I'm not integrating the things that I learned from these places and these experiences, I'm going to resort back to how I was feeling before. So without integration, I kept, just getting worse and worse and worse. And once TMS didn't work, my psychiatrist was like, it's not as barbaric as it used to be. They use general anesthetic. You're knocked out when they shock you,
For anyone who doesn't know what ECT is, can you explain what the experience is and how it's meant to heal?
Yeah, you go in and I have a lot of metal. So I had to replace all of the metal in my face and, with plastic earrings and you go in, you got your hospital gown. They knock you out, strap you down, put a bite guard in your mouth, electrocute you. It helps with the neuroplasticity in your brain. If I'm not mistaken, it still is the leading most effective form of depression treatment. I did 9 sessions in 3 weeks.
Is it painful? Or you're not feeling anything?
The first couple times it is, because they're still figuring out how much, Tylenol or Toradol to give you afterwards. I'm very anal about like, if I'm going to be going under, what are you giving me? What are you not? I've had experiences where, they gave me something that felt too good. And it's like, okay, let's, daily maintenance, keep the sobriety going, So I definitely ask multiple times, and I have OCD, so it tells me to. But yeah, the first time I woke up and it was the most sharp pain I'd ever experienced in the side of my head. Like it was.
And what is that pain? What do they tell you that is?
Well, it's soreness from getting electrocuted.
That sounds so scary.
Yeah, it was. And the side effects are gnarly. I definitely had days completely not in my head at all. I'd have, friends visit me and I don't remember even seeing them. I don't remember them coming by. I have evidence that a friend came by because she brought me a bag of vapes. This was before I quit vaping. But I don't remember her being here at all. I don't remember the conversations we had. Amnesia was one of the primary side effects of that.
Was there no part of you that was scared, or you just felt that was the last resort?
I'm very much a lead with the chin kind of person. And so, yes, there's some fear. The biggest fear is, what if this doesn't work? There was definitely a point where I just had to stop because, I was responding to the treatments and it was working. But then there was a discussion of like, well, you're either going to be on these 2 medications for the rest of your life, or you're going to have to come back once a month and continue getting shocked for the rest of your life. And I'm like, that's not going to fucking work for me. And I think, little bits and pieces of everything that I'd gotten along the way over those course of those last 2.5 years, taking everything I possibly could and just completely flipping my life on its ass and being like, how do I do this in a way that is sustainable?